On July 19th, the Centers for Medicare and Medicaid Services announced that they required 6 states to stop their Medicaid unwinding effort in an attempt to correct mistakes that were being made. These states were also ordered to reinstate those individuals that had been terminated without the full due process that was required. The most common failing was not data matching correctly to keep people enrolled, failing at those administrative renewals. They said a lot of times people were being terminated because of system glitches. The feds then asked the states to stop terminating people from Medicaid unwinding until these fixes could be put in place. The announcement comes on the heels of an updated unwinding data release. We now know that over 3 million people have been terminated from their Medicaid during this unwinding process. On average, about 74% of those terminated were for procedural reasons, paperwork issues, renewal deadlines, system glitches, etc. 3 states actually had procedural terminations over 90%: Georgia, South Carolina, and New Mexico. In a statement, the Centers for Medicare and Medicaid Services Administrator, Jaquita Brooks-LaShore, said, "Make no mistake, where we have found problems or violations of federal requirements, we are taking action to ensure that states correct the issue immediately." She continues, "We are using every lever at our disposal to protect and preserve people's access to health care and to work with states to address compliance issues that may hinder continued enrollment of eligible people." Now, the states are cooperating, the feds tell us. They said they wouldn't name those 6 states. You can kind of get a hint maybe from those 3 that are terminating at over 90% for procedural reasons. But they said where issues were identified, states were directed to pause procedural terminations and reinstate those individuals and make remedies. They said the states have responded to that. They have complied with those requests, and they are working, what they say is, in a collaborative way to identify ways that they can make the fixes they need to make while holding enrollees harmless. Now, right here in the state of Wisconsin, the only people that should be taking unwinding action steps right now are people with the July renewal date. If you have a renewal date in the month of July 2023, you should be turning in your renewal packet to make sure that you can be reevaluated for coverage. If you have an August renewal date, watch the mail. You're going to be getting your renewal packet. If you don't have a renewal date in any of those months, there are no action steps that are required at this time. To read more on that unwinding pause in 6 states or to see the updated unwinding tracker, we link to resources in the description below.